Hey, so have you ever had, one of these show up in your office? One of these like wrists that was in pain. That's why they're there, actually. They're attached to someone, but they show up because they're having problems, right? I mean, it has to be that way. Stick with me here. So imagine for a second, there was like this strap holding that wrist down. Imagine there was this big strap and it was pulling on either side of the wrist. It was holding on to it and it was pulling down. And so generally what you get is a downward force, a downward compressive force to the wrist. Imagine we were just doing that. So it's pulling and pulling and pulling and pushing in a way. And you would expect some of these bones to change in their shape and position because of that. Understand you got a whole synovial joint in here. You got the synovial joint between the radius ulna articulation and then the synovial joints between the individual bones. And there's too many of those to count. Let's be real here. Way too many. And understand that with this type of compression, it would be a lot harder for the wrist to do a lot of this stuff here, back, forth, left, right, that kind of thing. That doesn't make sense. Further to that point, in addition to this motion restriction, it wouldn't be strange to start to see the wrist bones actually really change position and even a little bit of shape with this type of compression. Imagine for a second these started to shift out of place because they have the ability to do that. Again, they are synovial joints and they are allowed to move because of that to some degree. And so seeing a shape like this, really would change the arch. It could really, compress that arch, which could be a problem. I don't know what you'd call that, but it could be a problem for anything that goes through that arch. So motion problems, shifting problems, but that's not all there is. I mean, it's never done. But think about where this stuff is coming from. There is an equivalent of this strap pulling kind of thing because we actually have muscles in the front and the back of the forearm. We call these the flexors, and they attach to the medial epicondyle, and the extensors, and they attach to the lateral epicondyle. And they can pull in the same kind of compressive way. They can generate the same kind of force like that, compressing the wrist and changing the shape of the joints, how they articulate, how they interface, and therefore how they move, and maybe what could cause pain in the area. But again, that's not all. As usual, it's never enough. So think about it for a second. You have got muscles, and those muscles need to have a belly somewhere. They need to have a bulk of their contractile tissue, and it's mainly at the proximal portions. This is a huge exaggeration here, but that's more or less how it works. By comparison, the longer parts here, these are more tendinous in nature, meaning they're non-contractile, generally speaking. So if I want to generate this downward force, this compressive force that we're talking about, it's not actually at the wrist. It could be coming from somewhere much lower as contraction, somewhere in and around here. So to get rid of some of that compression, it wouldn't be unreasonable to actually work with this area before we do anything to this area. Now, interestingly, to add to that, there is some other muscles in the region because it crosses the elbow to get to the wrist. There's a tricep muscle that we should consider, and probably a bicep muscle too, because that's doing that as well. That's kind of a big deal. And so we have to consider that the position of the elbow, because the forearm muscles are attached to the elbow, may be relevant to the wrist, because it's doing that, flexion and extension. We could also make a big deal out of the nerves that come out of the neck that actually power all those muscles, but let's not get overly complicated here. So, in a really simple way, if I want to get rid of this compression, which could change the movement of the wrist and affect the position of the joints, I should probably start to do something like this.